Good afternoon. Thank you for being here. And welcome to Resilient Georgia's August Lunch and Learn. If you're new here, Resilient Georgia hosts 7 Lunch and Learns a year that cover a variety of topics spanning child welfare, policy and advocacy efforts, prevention, training and education, and innovative programs and collaborative efforts happening in local communities and across our state. Just a disclaimer, our lunch and learns are recorded. So please feel free to turn off your camera if you'd like, eat your lunch if it's at your desk, and that we ask you that you stay muted until our Q&A towards the end of today's presentation. However, please feel free to use the chat, drop your name in there, say hi to everyone if you'd like. And then all the resources that are shared during the presentation, as well as the recording from today's session, will be sent in a follow-up email to everyone who attended by early next week. So just be on the lookout for that. And the recording gets posted on our website. With all that said, I'm excited to introduce our guest today, Dr. Stephen Patrick, who is a professor and chair of the Department of Child Health Policy at Emory University's Rollins School of Public Health. Dr. Patrick, I'll hand it over to you.
Hey everyone, it's great to be here with you all. I know some of you attended the webinar yesterday where we released these data. We're going to dive a little bit deeper into some data here, but I do want this to be interactive. Just briefly, I'll quickly introduce myself. So I'm a newborn ICU doctor by background. I work clinically here in Atlanta at Children's and chair of the Department of Health Policy and Management. And the Center for Child Health Policy, you can see our website on the bottom right is www.childpolicy.org. I need some more caffeine, I think. There you can find some of the work that we're starting to do. This is the second annual release of the state of child health and well-being in Georgia. We'll do this every year, and some questions you'll see here we repeat just to see how things are changing over time, and some things are new based upon what we hear from community partners. So I'm going to dive in. So this is a little bit about why we do what we do. Our goal really is to elevate the voices of parents, and as you know, to understand what parents and caregivers want us all to know about what's going on with their children, and want communities and policymakers to know as well. We survey in a way that's fairly rapid, so that we can have more real-time data. You know, on the other side of what we do is very research-based, and gosh, that can take a really long time. So we do this as a way to be more timely when we get with the data that we get. So the data I'm going to present here, it's from a survey that we did near the end of last year, and you know we release it slowly throughout the year, and then have the final report like that we released yesterday. It's 1,000 parents in Georgia. This year we oversampled rural communities, and it is sampled to be representative of Georgia parents. And we do this using data from the U.S. Census. So when I say things moving forward about, you know, the percentage of Georgia parents or the percentage of families with children, that is statistically representative, just like a poll would be of Georgia parents. It is not just a sample of 1,000. Each person represents a portion of the population, and that's weighted to create averages for parents. All right, before we start, what issue do you believe Georgia parents rank as the highest threat to their child's well-being today? You can just put it in the chat, and we'll kind of get, or let's see what we got. I see social media. Great. Social media, mental health, mental health. I see more social media. All right. Believe it or not, this year, this is the first year we've had this. The number one concern parents have is gun violence. We've done this for a number of years. We did this, our team moved from Nashville. We were at Vanderbilt to here at Emory. So we did this same series of questions in Tennessee too for a number of years. Education and school quality has almost always been number one. This year, gun violence is the leading concern for parents. I will say there is a statistical tie with the top three. So let's look at those a little bit more. So here's the top concerns of Georgia parents, and they were able to rank three things. So these are put together in those three things: gun violence, education and school quality, social media, and mental health, and bullying, including cyberbullying. And I'm just pulling out some of the things that different parents rank. Racism was a chief concern for Black parents. Car accidents for Hispanic parents. Drug and alcohol use ranks highest in their concern. For white parents, physical activity and healthy eating rises to the top two. So I think it's important, and you'll see this throughout our poll. We look at different experiences of parents based upon race. We also pull out education and income because different families have different experiences within Georgia. And you'll see that really specifically around income as we walk through. There's some specific challenges that we're seeing in Georgia today for parents. We'll start with food security. So we use the USDA standardized screener for food insecurity. And what is pretty striking here is about 1 in 3 Georgia households with kids are food insecure. And if you break down the very low, this is cut off a little bit on the overall, very low and low, this is actually skipping meals, and that's about 1 in 5. Um, you can see how lower income families are disproportionately affected. We do see Black and Hispanic families more affected than white families, and rural communities also more affected. What is striking as we dive into these data, and first off, I would just encourage you to look at our full report at childpolicy.org because you can dive into the data a little bit more. What's striking about this are some of the details of what parents are doing, and I'll have some of this on the next couple slides too. But one thing that strikes me is about a quarter of parents in Georgia have skipped meals because of food costs, other things like that, but only about 2% of kids have. For me, this just shows parents doing what parents do. They're sort of taking the brunt of things to try to protect their kids. But even with that, think about this. That's 1 in 50 kids that are still skipping meals. Um, so families, about 60% of Georgia families changed the way that they've done meals or food habits over the last year because of cost. And I'll tell you that, we're going to be watching this really closely. We're going to go into the field again here in the next few months. There have been a lot of changes because of HR 1, the big beautiful bill that directly affects food and particularly SNAP. There's about 14% of students lost access to free meals at time, and then we asked parents about SNAP. Uh, of parents who were enrolled in SNAP, about half lost benefits, at least temporarily. Now, you remember the government shutdown we had for a period of time, like people lost access for a period of time. But what we've seen over the last 6 months has been a lot of disenrollment, including estimates are that at least 1 million children nationwide have lost access to SNAP. But we asked parents, like, what do we do about this? And 86% of parents support universal free meals at schools. And, if you'll recall, as we went through COVID, meals were free in school. This was a waiver from the USDA. So we had this period of time where we had basically a massive investment in meals at school. Uh, Parents support this. And since that time, several states have enacted universal free meals, but Georgia has not yet. Um, Mental health are some of the data that were released yesterday. So mental health diagnoses are not uncommon in among Georgia kids. We ask this in two different ways. We ask parents, has your child received a formal diagnosis from a healthcare provider? And we also ask, are you worried that your child might have this condition? I think this is also revealing because it gives you a little bit of what parents are thinking. ADHD is held pretty solid. Parents are describing this year just a little bit less anxiety. We'll see how this goes over time. The repeated measure every year, we'll measure this every year. But still, we have about, 1 in 5 Georgia parents say that their kids have been diagnosed with anxiety or or they're worried they might have anxiety. We also asked a series of other questions about isolation. About half of parents are worried their child might feel socially isolated. But if we dive a little bit deeper into this, parents, and this is a consistent theme we saw this year, parents are really supportive of schools being active in the space. First off, around 40% of children were described as that needed treatment were receiving services in school when we asked. But parents are very supportive of both screening and treatment in schools. And this was surprising to me, in part because, I mean, gosh, just think about news headlines over the last, 10 years or so, parents concerned about, mental health screening in schools and treatment in schools. But what we're finding is that Georgia parents are supportive, and we have seen an expansion of mental health services in Georgia schools specifically, but there's clearly still room to grow. And I think the other piece of this too is just adding on, like we keep on like it's easy for us to say, it's easy for me to say, like, oh, this is a great place for schools. That said, we have to provide the resources to the schools, and that's not just money, that's also the right people and that are available. If you've watched this week, there's been a fair amount, and as a pediatrician, um, it's been an extraordinary 2 years talking about vaccines. The executive order that was signed this week, if you follow it, created this hierarchy of vaccines where we have, everyone should get, high risk groups should get. That executive order didn't actually cite new research at all. It didn't actually cite any research in the executive order if you read it. Um, but the language it uses a lot is about, parents and what parents want. I think this is really quite useful to understand what parents think about vaccines. So most Georgia parents believe routine vaccines are safe or very safe, and most parents, about only about 10% say that we should have no requirements for school at all. So parents are mostly supportive of routine childhood vaccines. The most trusted source for vaccine information remains your child's doctor. And I think in the where we're in this really confusing time, I know for my own patients, like information's coming in from everywhere. All these sources, like who do you trust? Do you trust the person that you've chosen to care for your child? And so that's what we're seeing from Georgia parents. That is by far the most trusted. We also surveyed, other like federal agencies like CDC. All of those are much lower than your child's doctor. This has been pretty consistent, excuse me, in our polling through the years. The one thing I'll mention is, because of what we've walked through with vaccines, most people didn't know what ACIP was 2 years ago, and you still might not have heard of it. It's a committee that is at CDC. It's been around for years that evaluates everything from evidence on vaccines to effectiveness and even cost in some ways, right? The recommendations from that committee inform insurance coverage and other things like that, including the Vaccines for Children's program. Um, what has been worrisome, if you've watched some of what's happened around that committee, um, first off, it's not even meeting right now, but there have been a lot of changes and recommendations. Again, not a lot of evidence based. But the worrisome part for that is that insurance coverage may follow. And I think the worrisome part about this week's EO is that insurance coverage may follow. So we asked parents first, did you know about ACIP? Most parents didn't. And how likely would you be to pay out of pocket for vaccines if you had to? Only about 34% said they would. If you look at incomes of families less than $75,000 a year, less than a quarter would. So what's important about this is all these recommendations that we're hearing, all the conversations we're hearing, the potential on the ground, the worrisome part is that there may be challenges with actually accessing those vaccines. That hasn't happened yet, but I think that's one of the things that we're all worried about. And we can talk about this in questions. Technology, I have two kids. Technology, we asked about how much screen time kids are getting, and this is the average. This is the estimate that parents gave us, about 3.8 hours a day, using for fun, social media, gaming. Parents are concerned about it, and I think the other thing we see is parents aren't really sure what to do about it. And I think this is where acknowledging the problem, having a conversation with your kids like we do, and probably all of you do too, as well as creating real ways to restrict access to certain things. Like it's not the most popular thing with my 15-year-old, but our internet cuts out at a certain time, and the iPhone, which my kids have too, it enables you to sort of create time limits on certain apps too. But in the lead up to the conversation that the General Assembly was having on whether or not we should ban phones in high schools, we asked parents, "What do you think about this?" And most parents support that. Around 71% supported the ban that was passed. And we asked this before the ban happened. We actually used these. We put it out to inform the legislature. We asked parents like why or why not. Parents support it in part because they think it's going to improve learning and it's going to improve kids' ability to interact socially. For parents who did not support it, and that other 30%, it's almost all about safety. They're worried about safety concerns, and I get that too. If we've got, I mean, my child's school goes on lockdown from time to time. It is nice to be able to get a hold of them, but I think these are the trade-offs that parents are walking through. We worked with the YMCA of Georgia, or excuse me, of Atlanta, to ask some questions around swimming as they're thinking about expanding some of their programs. And drowning is one of the leading causes of kids in the U.S. So this is an important thing. I think one of the things that was pretty striking here is the racial gap. Fewer black children know how to swim compared to white children. We saw this from parents too. So this is an area where expanding services, making sure that we are, intentional about providing those skills to Georgia kids is important just for their own safety. So, one thing I really like about this is, the YMCA is using these data to inform some of their programs as they work to expand. Um, Cost is a big barrier of these lessons, and so that was cited by multiple parents. And again, I think part of the issue here is we're seeing cost as a barrier for so many things, whether that's food, the potential for vaccines, and for swimming. There are some swim lesson voucher programs. Florida has one that provide some ability to kind of expand access to swim lessons. So if we sort of walk through all these pieces together, um, sorry, my dogs are going to bark now. I'm sitting in my kitchen. Um, yeah, there we go. Sorry about that. So I'm gonna let my dogs out real quick. Apologies. This is what happens when you have a hound. So most parents support universal free meals in schools. And so that's part of the blueprint that parents are telling us. Mental health, parents also support screening in schools. Vaccines, parents are telling us that they're worried if they have to pay for it out of pocket. They may not do it and that's a huge public health issue. Um, Tech, most parents support device bans. And then back to injury prevention, lower income families are priced out of some of these lessons. So this is a little bit of just a summary of what parents are telling us. So if you go to our website, here's a QR code. If you go to our website, you can download the report. You can also look at last year's report. We're going to be doing some things over the next several months that will where we're going to change the website, make the data interactive. We've already created it, and we're working now, just as an aside for all of you, like we're working with a couple of WVU. So I'm originally from West Virginia, WVU and the University of Kentucky on similar work on kids in Appalachia. And then we're working on using a combination of stories as well as our polling work towards a really a comprehensive middle of the road, like center of America a policy agenda for kids. Because I think one of the things as parents, like we know this across, you guys know this from your work, I know this from my work. It doesn't matter if you live in Albany or you live in Atlanta or people generally want the same thing for their kids. And I think one of the things from our work, we want to highlight what parents are walking through because I think most of the time parents agree. Like we want the same things for our kids. So developing a policy agenda for kids, I think it's a unifying piece. We see that in our data. Most people agree on most things. So that's part of what we're going to be exploring over the next little bit. So I'm looking forward to the discussion we're going to have. and I'll stop sharing.
Thank you so much.
Sorry for my dogs.
Um, we love animals. It's okay. It's okay if they interrupt. Does anyone have any questions for Dr. Patrick?
Hi, I have a quick question. I haven't looked at your data, but is it broken down by local areas? Like when we access it, can we break it down by counties or zip codes or how
You
does that
can't,
work?
you can't, unfortunately, and it's in part because the it's sampled to be representative of Georgia parents. You can break out by certain groups and by rural versus urban, but you can't get down to that level of detail because it won't be representative. So that's just unfortunately one of the limitations of the data.
And I put the results in the chat for anyone that wasn't able to scan the QR code.
Yeah, I also have a question. I'd love to know, Doc, how we can be a part of the research study that you guys are doing. This summer, we had the opportunity to serve over 2,000 students in the city of Albany for summer programming, and we did our own level of data collection from poverty rates to
Mm.
swimming diversions to working with students with autism and also homeless. So we'd love to be able to be a part of some of the research that you guys are doing. To your point earlier around swimming, the need for swimming, this year we were able to provide over I think it was 455 students swimming lessons in the city of Albany at no
Awesome.
cost to them. So reducing that barrier around access to these resources because we know the population that we serve, we know resources are always a barrier for those types of servicing. So I'd love to be able to have conversation around how we can be a part or submit our impact data that we were able to collect from this summer to you guys to consider and review for your own purpose.
Well, Orson, thanks for that. I mean, first off, just thanks for the work that you're doing. However we can partner, we would love to. I mean, we're a pretty small team. With that said, one of our goals for this, like the reason why we're doing this every year, is to gain momentum and try to partner and make a bigger impact in Georgia. So, I would love to talk. I put in my email address in the chat. The chat. Sorry about my talk. She's a husky mix, and like, she's just always has opinions. Um, this is I don't usually work from home, and so this is why. Anyway, if you email me, we'll work out ways. The other thing that what we did in Tennessee, so I've been here about 2 years. In Tennessee, we had a group of parents and leaders that helped inform questions. We're doing that, but we'd like to do that in a more structured way. So what you're seeing in your communities, that can inform the questions we ask just like we did with the YMCA, we want the data to be useful. So they're able to use that for their work. If there are things within all of your work, you're like, gosh, I'd really like to have data for Georgia kids about X, Y, or Z. Please let us know. I mean, we every year we add questions based upon the needs of community partners. So let us know how it can be helpful and love to connect at some point too.
Thank you.
Yes, sir.
Hello, I'm going to jump in there. Hi, thank you. This has just been wonderful to hear all this information. Um, I'm kind of going back to the section on mental health screening and treatment in schools. I found it interesting because working with school systems, we hear a lot of times from kind of the higher ups that they need to focus on the academics and that's where their priority lies. But seeing this is the first time I've ever actually seen that parents are, they kind of we're getting from school systems that they're doing this because that's what the parents want. So this is kind of the first data that I've ever seen that said, 83% of parents actually support mental health screenings in schools. Um, Leads to my question, are there any initiatives or anything that you see taking place that kind of will help support getting this data to school systems? Is there anything that's already going on to kind of say, no, this is what parents actually want? Um, So it's kind of an open-ended question. Are there any initiatives related to this that you would point people to?
Well, I would ask you all. So as we're working to get data out, how could we best get this to schools? Because, as public health and healthcare delivery, where do you think we should do it? I think there are some kind of combinations of work that's happening. I'm aware of some work that's like Vita Johnson from, I don't know if you guys know her, general pediatrician, you do, yeah. So she's doing some work, but also the Carter Center has done some work to expand access in Georgia, and specifically, focused on schools. And there have been some policy changes over the last 10 years to nationally to help bill Medicaid too. So I think there's space here. I think it does get back, Katie, to um, we need to get the information to school leaders, but we also need to get them the resources too. I mean, one thing I Dr. Harvey, that's a great question. So she's asking about a one pager. Yeah, we can generate something like that and I'll send it out to this group. But what I was going to say is like my own child, it goes to a Georgia public school, and we get an email with here's some screening information of how they screened, and I'm like, okay, like what am I supposed to do with that? So I do think like we're starting to talk about it. Like there's the screen, but like what do we? So there needs to be some connection.
Yeah, I feel like actually, because we're working with, I'm one of the co-leads with the Resilient West Central Georgia Coalition, and Resilient Georgia has been so helpful, kind of getting some of
Yeah.
our initiatives going or partnering with them, and just having to, just to be honest, to have the Emory, Center for Public Health having this information, so a one pager or something, it gives a little bit of validity and weight behind the things we're trying to get put in place. So I really appreciate it. And any sort of like was it Dr. Henry? Is that on? Make sure Dr. Johnson, Dr. Hervey, there you go, Dr. Hervey, mentioned any sort of way we can package this and use it to, show that this isn't just one organization or one parent or one county. There has been, substantial data collected on this would be very helpful.
Um, Katie, I just put into the chat our press release from yesterday, which is
One,
focused on mental health and focused on and we have some of the school-based data. So I'd be curious how that works, if that would work to people's. We also can prepare something that you can use. Like we can do that pretty quickly to have like a one pager with our logo, all of that, whatever would be useful.
yeah, no, this is very helpful. Thank you so much.
Of course.
Audrey put a few links in the chat around school-based behavioral health and folks doing great things in that area. If you want to learn more, then just connect back with one of us and we'll connect with you or connect them with you.
Right. Talking about the School-Based Behavioral Health Collaborative.
Yeah.
They're working, and we are part of this group. It's led by the Carter Center and has Georgia Appleseed and Voices. And we've been working on developing innovation labs. And there's going to be the first one in Macon on September 19th. I don't know, Katie, if you've got an invitation, I'm going to forward that to you. And I think this would be also a great place to bring this data. Obviously, like we're gathering local partners to really think about how to work through policy on the local level and what needs to be uplifted as well.
It's a great point, Audrey, and I'm mindful too. Like, well, first off, as you can sense, like there's a ton of data here, and like we can't be experts in all this stuff, but we don't want to like impede collecting the data and getting it out there. But this is why, this is not the Emory or the Rollins, like this is Georgia. Like we intentionally named it that way so that it could be useful and we could elevate the expertise of folks like you all. So we want this to be useful. We want to elevate your expertise because like I know this much about this many things, right? So the goal is to make this useful and get it out there. So help us sort of think through how can we sort of build up to Orson's part before, like how can we sort of support the work that you're doing? It's a good reminder that I need to send this to the Carter Center too.
I think Jordan has her hand up.
Yeah, this is wonderful work. I'm just for a little bit of background, I am a grad student at Georgia State, And a lot of kind of the fields we go into is program evaluation, and that's always like on my mind. And that is one way to kind of bridge the gap between what we see in data and what we want to do in influencing schools, whether that be after school programs, that be specific programs in schools to help with targeted issues. And I think that that could be one way to kind of turn the data into practice in one way, shape, or form. Use it for specific needs that we see, and using kind of what we see in the literature and data to kind of help that. And so that's kind of where my brain went to when I heard you speak. There's so much potential there, but I'm definitely going to keep this on my radar when it comes to how we can kind of bridge that gap, especially for what Katie was just talking about as well. So,
That's great. Thank you, Jordan. Liz, I see you.
Yes, I was really interested in kind of some of the information that you were sharing about parent perception of vaccines.
Yes.
And I was really curious, like for the vaccines that are potentially, because I know there's like a whole stay and all that going on in the court right now as well, right? So we're not full out, but we're headed in that direction, seems. For vaccines that shifted to shared clinical decision making, would you expect insurance still to cover that? Or would the classification itself kind of just create that new out-of-pocket risk for parents?
That's the worry. And, one of the things in the language around shared decision making, like I, every vaccine I've ever given any kid is shared decision making. Like it's not like, we walk around. I think that language for me is like, it's not like we walk around with like, oh, here's a vaccine, here's a vaccine. Like if you guys have gone to your pediatrician before, like you has a conversation about the vaccines, right? I think the worry is like, where is this heading? To Liz's point, so the changes that were made, there was a lawsuit that paused the changes. The EO is in a response to that lawsuit. They actually cite the lawsuit and basically do the same thing. So the question is like, what is the real world effect of this? We don't really know. Thus far, insurance companies have covered it. I suspect the insurance companies will go with the vaccine schedule that the American Academy of Pediatrics and other large um, medical groups have pulled together. That schedule is basically what the previously endorsed CDC schedule was. So I think there's some unknowns, and one of the things in particular that there's an unknown about is the Vaccines for Children's program. So if you're in commercial insurance, I suspect like it would be hard for me to believe that commercial insurance is going to make put barriers to like meningococcal vaccine. I do worry about like what could happen for Vaccines for Children. And Vaccines for Children is a program that provides vaccines for lower income children. That's where I worry. And I think in particular, if you're talking about lower income children, if that becomes a barrier, then cost is also a barrier. So this is where I think we just have to keep watching and communicating. And I think probably the most harmful thing right now is really just the communication and the kind of constant narrative about vaccines that we're hearing that is not helpful. But I think what we're hearing from parents, and we'll keep checking on this, is that for the most part, they're kind of keeping their head down and and kind of continue to do their thing. Though I will say, like, this is a really long-winded answer, so I'm sorry for that. We have seen some decreases in kindergarten readiness in Georgia compared to previous years, specifically around MMR. That does give me some pause because we are in the midst of the highest rate of measles in the U.S. in more than 20 years, and we are already at the rate that we ended last year with. Measles is super infectious, and about 1 in 1,000 children die from measles. So when we hear a press conference from the White House where it was claimed that if 5% of kids die from the MMR vaccine, which is completely like that's I mean you can look at that at face value and know that that's just not true. That was the endorsement for having a separate MMR. No company makes a separate MMR, and at least like my children, if I offer them like here's one vaccine versus three, they're going to choose one. 5 out of 5 5-year-olds, right? So I think it's really about the messaging that's happening. So what I worry about, so if parents hear that, then it puts a little bit of doubt, like maybe I shouldn't do the MMR, and then we end up with, more measles outbreaks.
I wanted, Andrea, there was one question before, if you don't mind, unless it's related to this. Vaccines. I
No,
don't
I
want
was
to
just
change the topic.
ask my question that I put in the chat.
Oh, okay. I just wanted to touch on, Emily Ann asked, or said that she'd love to hear more about racism data that you've collected, any dissemination plans or further work planned there.
I mean, this is the dissemination plan. Like we're happy to sort of do more. And I guess, and it's not just about, there's a couple of things that are there. It's not just about parent concerns about racism, but there are clear disparities in the data that we find too. So we put that in the report. We want the report to be useful. If there are more things that we can do, we'd be happy to do those things too.
Hello, Andrea here.
Andrea.
Do y'all ask any questions about housing and affordable housing, or does that come up for parents? I feel like it's comes up a lot in the community work we do,
Yeah.
at least in Middle Georgia, and I'd be very interested to see the breakdown between the demographics on that concern.
We have not asked that question before. That is certainly something we talked about it a little bit this year. It's certainly something we consider for next year. And I would say to you all, and we did this yesterday when we had our webinar, if people have themes that they're seeing in their communities where you're like, gosh, I wish we had questions about that, please email us. Because we will start, like we go through a process of developing our own questions where we can, we'll lean in on if we find standardized tools to ask questions from national surveys, we'll do that too. But I think it's a great point and clearly is becoming an increasing challenge.
And then we had a comment concerning the state-led swim lesson vouchers. Is this actually in the works? I know the YMCA and Boys and Girls Club and Brooks and Lowndes counties focus on swimming lessons, and that voucher could be super helpful.
I can link back to some folks at the YMCA. There's not anything from a state legislation point that I'm aware of, but I do know the YMCA in particular has been working on expanding their programs. I'm most familiar with the Metro Y because it was our colleagues there that brought this to us, and they used the data to talk about their program. But I don't know the answer to that.
Well, maybe since our two United Way folks are
Yeah,
both brought up that point, maybe that's a conversation to have with statewide United Way.
I love that.
I have another question, but I don't want to be hogging the time. But we're having a lot of conversations about positive childhood experiences and asking parents more about that piece. And I'm just brainstorming here about how we can maybe ask about what do you have access to in your community, like green space or play areas or things like that, because we know it's not necessarily your ACE number, it's your positive buffer against your ACEs that really impact the outcomes. So just thinking out loud about how we could infuse some of that into the questions in the future, like, can you, like swimming could be a negative childhood experience, but could also be a wonderful positive childhood experience if you have the, support and being able to swim. So just brainstorming.
Andrea, I love that. And I think, as we talk through adverse child experiences, part of this, like that sort of negative frame as opposed to a positive frame around resilience and other things. I mean, hence the name Resilient Georgia, right? I think that's a great point. And if there are things, you have a lot of great ideas for questions. So please feel free to email me these questions and I'll get it to our team because I do think one of the challenges we have, like even just presenting the data, like what positive thing did I just present? Right? And it's a lot of like, here's the concerns, and that's important to lead to a policy agenda. But I do think like, we could sort of bridge in some other things. So happy to. I think that's a great idea.
Yes, definitely. We've been talking about creating conditions where the good can grow. So even though we're talking about, the deficits and the challenges that our state faces, where can we uplift and make sure that communities are still thriving? And PCA Georgia is leading work around hope informed work, and they just put out a toolkit. So if you haven't checked that out, that's a great resource and to learn more about how you can uplift data and information and the initiatives that you're doing.
Love it. I just
And then I guess we have time for maybe like one more question. Julie put in the chat, I'm curious if you collect information about the parents that answer the survey questions.
We do. We've intentionally, for a lot of these things, not asked about voting or politics, in part because we're trying to to avoid that. I will say there are some things where we have in the past. So we just, for an example, like this is one section of what we do. We did a national poll of registered voters leading into the 2024 election around specific child policies, and we asked people, their sort of political leanings. We also asked nationally about some changes that were happening in HHS affecting kids, about like who they voted for, in part because like the question is like, is this what you wanted? Or did you disagree with it? Like, so I think that can be a helpful discourse. But you all know right now, like, I mean, part of what we're hoping to do is to unify voices around kids, because I think, it doesn't matter if for someone on the left or the right, what we see here is like parents agree in large step, and that's where we're heading. What I would say, like I'll foreshadow what we're going to try and do at the end of this, towards the end of the calendar year, is launch a national effort that is middle of the road, a parent informed agenda for kids. And we just got out of the field with a national poll, and we're going to try and make this like the messaging super simple. My own sort of reflection as somebody who's been in the space for a while and is a pediatrician, there are all these silos of people trying to do good, and we sometimes speak different languages, um, but kids operate in so many different places. Part of it is like we just need to kind of be on the same page. Like kids kids do not like rise to the top of any conversation, and yet we all sort of care about what we're doing. And I know I'm talking to a bunch of people. I'm literally preaching to the choir right now, but part of what we're going to try and do is do really simple messaging, really kind of clear, like 3 policy priorities nationally, and really just like push it. And to make it really clear, to make it middle of the road, this is what parents agree on. And I'm going to foreshadow what I think the 3 things are going to be from our national work. We ask parents nationally, parents and caregivers, what do kids deserve? And I think that framing is so important, right? And the number 1 thing is food. The number 2 thing is health. And the number 3 thing is around family stability. And so our framing that we're sort of testing going at this is kids deserve to be fed, healthy, and home. So those are the things that we're sort of working on, and we're going to work to gather some stories. The other thing I would say about this is part of what we're going to do, and I realize I'm like running up against the clock, is literally collect stories from parents, because like data are one thing, stories connect in a very different way. So that's part of what we're going to be working on over the next little bit. So if you have folks who want to talk, or if you're a parent and want to talk about some stories and things you're working through, we would love to chat more.
Awesome. Thank you again so much, Dr. Patrick, for all of the wonderful resources and information you shared. So many great questions and conversations. Again, I'll send a follow-up email by next week with everything that we put in the chat today, and as well as the recording. And if it's okay with you, if you don't mind me putting your contact information for
I don't
folks to
mind
reach
at all.
out. Okay,
Yeah.
awesome. Well, thank you so much, everyone. And we will see you at a future Lunch and Learn or at a next RG meeting. I hope you have a wonderful rest of your day.
Bye, y'all.
And if you have a moment,
you.
please consider
Oh,
taking our
and take our evaluation survey. Sorry, I put it in the chat twice, forgot to say it.
Thanks.
Already done.
Thank you, everyone.
Thanks, everybody. Bye.